everyone, welcome back to another episode of Be a Nurse They Said. My name's Lainey and I'm so happy that you're here. If you have not gotten the chance to yet, make sure to hit that subscribe button so you can stay up to date on all things Be a Nurse They Said. Clinical days can be very scary when you're a nursing student. They can be stressful, they can be overwhelming, and they can give you a lot of anxiety. I'm going to go over some tips for before, during, and after clinical to hopefully ease some of that anxiety and make it not so stressful for you. So first, let's talk about before clinical and things that you should do. First is review your patients. If you have to go in the day before and get your clinical assignment, this is a perfect opportunity to do that. If not, try and be a little early the day of clinical and get your clinical assignment and look up your patient. Look up their diagnosis and the background patho of that. Look up their medications, look up their labs, so you kind of understand the patient as a whole before you even start your clinical day. This will make things a little easier as you go throughout your day and you have conversations with your clinical instructor about your patients. Make sure to look up anything unfamiliar to you that you come across in their medications, in their diagnoses, so you can understand that. Make sure that before you're going to clinical, you're refreshing on your skills. So if you're on a particular unit that has a lot of straight caths or indwelling catheters, make sure you're reviewing that skill. That way, if that opportunity presents itself, you're ready and prepared to do that. Get yourself ready the night before. So get your scrubs and your shoes out the night before, have that ready to go. Make sure all your supplies like your stethoscope, pen light, pens, clinical report sheets, all of that are ready the night before, and pack your lunch the night before. That way you don't have to rush around the morning of clinical feeling unprepared. You can have everything ready to go and be ready to start your day. Lastly, before clinical, go in with goals for the day. What do you want to accomplish that day? That way, after clinical is over, you can look back and reflect on those goals and see if you met what you were looking to meet. Next, let's talk about what you need to do during clinical in order to be successful. Very importantly, be present. Be present in all the things that you're going to learn, all the opportunities you have to do new skills and learn new things. Just really be present in your clinical day because that's how you're going to get the most out of the experience. Make sure to be helpful, help other nurses out, help other students, help the nursing aides, help whoever needs help, and always be willing to learn from them because you're going to learn something new every day that you're on clinical and moving forward every day as you work as a nurse. You're going to learn something new, so always be looking for those opportunities to learn. Do as many skills as you can if the opportunity presents itself. If you have an opportunity to put in an NG tube or do a straight cath, take those opportunities and don't stray away from those because that's how you're going to get more confident is by actually doing the skills. Keep a notebook or a to-do list. That way you get all of your things done for your patient throughout the day. Make sure that you're charting your assessment. If they have any lines or drains, make sure you're charting on those, emptying those, documenting I's and O's. So keeping a little to-do list or a checklist for yourself throughout the day really makes you stay accountable for your patient and the things you need to do for them. Always be professional when you're on the clinical floor. Every day you're out there on the clinical floor is like an interview. Other nurses, managers, everyone is always watching how you act, what you do, how you behave. So you want to make sure to always be professional and do your best. You never know where you're going to want to work and where you're going to have an opportunity to work, and managers talk to each other. So if they see things that they're not so fond of, they may pass this along to other managers. So always make sure you remember that every day on clinical is like a job interview. Next, make sure you're asking for help if you need it. It is okay to ask for help and there are no stupid questions. Like I said before, you're always learning and you're always going to learn new things and to look for those opportunities, but don't be afraid to ask for help if you need it. If you need help doing something, if you need clarification on something, or if you really don't understand what something means about your patient, please ask those questions. It's the only way you're going to learn and you're going to grow as a nurse. And then lastly, during clinical, obviously don't forget about patient safety. This is why we're all there to help our patients and get them better and keep them safe. So patient safety should be your number one goal. So always keep that in mind during your clinical experiences. Last, let's talk about after clinical. What should you do after clinical in order to be successful? As I said before clinical, create your goals for the day. Now after clinical, you're going to look back on those goals and reflect. What went well? What could have gone better? Kind of debrief on the day. This is another way that you're going to learn from your experiences. If you didn't get to during the clinical day, also make sure you look up anything that you didn't understand about your patient's diagnosis, about the patho behind the diagnosis, about any medications you came across. Look up anything unfamiliar so you can learn those things and apply them to future clinical experiences. Obviously, if you need to, complete your paperwork, whatever you have to do for your specific program that you're in. That way you can hand that into your clinical instructor and get feedback from them on how to improve for the next time. I talked about before you should refresh on your skills, but then obviously after clinical, practice those skills again if you need to. Practice makes perfect, and you cannot practice too much because it's only gonna make you better. Make sure after clinical that you're getting feedback, whether it's from your co-assigned nurse or your nursing instructor. Get feedback so you can use that feedback to grow as a nursing student and into a future nurse. And then lastly, make sure you rest. Clinical is a very long day. You're up early, you're up on your feet all day, you're busy, you're doing things. You need to rest. You need to rest your body and you need to rest your mind. So make sure you're resting and getting a good night's sleep. An important thing to keep in mind during all of your clinical experiences, before, during, and after, is that you will not know everything, but it is so important that you are willing to learn. Because like I said, you're going to learn something new every day, but you have to be willing and present for those opportunities in order to make yourself better and in order to learn more, in order to learn more skills and more knowledge. Another thing to keep in mind is that confidence comes with time. You're not going to be confident on your first day out there in clinical, but it will get better as you continue to practice as a nursing student and into your practice as a nurse. You should focus on improvement and not perfection. So I hope these clinical tips for before, during, and after clinical were helpful for you. Make sure to comment and let me know what tips you are going to apply to your practice as a nursing student. Also be sure to like this video, hit that subscribe button if you are not subscribed to me already, so you can stay up to date on all things Be a Nurse They Said. Also be sure to check out my TikTok and Instagram account, Be a Nurse They Said, where I post other shorts and updates on my content. And as always, don't just be a nurse, be amazing like I know you all are, and I'll see you next time.